Hey, you guys, Dr. Nicole here, talking to you today about what is coccydynia. So, dynia, the suffix here, means pain. And so, coccydynia simply means pain in the coccyx. And the coccyx is the medical term for the tailbone. And so, the end of your spine here is known as the tailbone or the coccyx. And this is a pelvis, right? This is as if somebody is turning their back to you. This is the front side of the pelvis. And this triangle shaped bone right here is called the sacrum. And then your spine sits on top of that. These are actually fused vertebrae together, and there's 5 of them, and that's the sacrum. And then there's actually 5 little fused bones here that sort of create what essentially is our little tail. Now, the interesting thing to note about the tailbone is that every single one of our pelvic floor muscles attaches in some form or fashion to the tailbone. The possible exception here would be the obturator internus, and that technically isn't a pelvic floor muscle. We call it like a cousin of the pelvic floor muscles. So but which is also a really important structure. However, it does not attach to the tailbone, but everything else here does. So even muscles that are over here technically have a connection way back to the tailbone. So part of the issue with tailbone pain is that the tailbone itself can be the source of pain, but unless you've actually fallen very acutely on your tailbone, the bone itself is usually not the direct source of your pain. That's where your brain is interpreting the pain to be, but sometimes it's actually not the tailbone itself. And some of the ways that a pelvic physical therapy can help is actually because we can actually palpate or touch all along the areas of this bony structure. Now, what's missing here is the big glute muscles, right? And some of the glute muscles actually attach here. So sometimes you can have a gluteal strain, or your butt muscles are really tight, and they can actually be what we call referring pain to the tailbone. There is a huge list of things that actually refers pain to the tailbone, meaning as a patient, you come in and you swear that the tailbone itself is hurt, fractured, dislocated, something, because that's where your brain is telling you the pain is coming from. But when we can actually pinpoint things around the tailbone, including some of the pelvic floor muscles, then the tailbone itself, when we actually are on the tailbone and touching it, it actually doesn't hurt. And some of the other areas around it will have either tender points or pain referral points where we can be pressing at some point away from the tailbone, your glutes, some of your pelvic floor muscles, and then your brain will say that is tailbone pain. So we actually can use the internal palpation of the pelvic floor to actually touch each and every one of the muscles that actually attaches there. So, and this goes for male or female. So this is where the vaginal canal would be open. A pelvic physical therapist can actually go in here and, number one, touch the actual bone of the tailbone. And then we can also feel the muscles and the nerves and the ligaments that are all along the tailbone. So very commonly, this bone or this muscle right here that's coming off of this bone will be the one where we're pressing, and as the patient, they're saying, oh, that's my tailbone pain. And then we know that it's actually the muscle here that is referring pain to the tailbone. Very similarly, if we can go through rectally, there's a lot of times where, especially in males, we will go in rectally and we can palpate the tailbone here. But actually some of these areas in white, which are ligaments around the tailbone, which help to stabilize it, are actually the painful structures. And we can actually feel the tailbone without it actually being very painful at all. But we touch right off to the side of it, and some of these muscles and some of those ligaments can actually be what we call as PTs, the pain generating structures. So the biggest thing for a pelvic floor physical therapist to be able to provide in this kind of scenario is that we can not only do all of the external things like a regular orthopedic physical therapist or a chiropractor can do, but we can also feel those internal pelvic floor muscles. We are specially trained in order to assess those. Now, there are some practitioners and a lot of chiropractors actually that are trained in adjusting this tailbone. So they have chiropractic techniques that can, what they say, can realign the tailbone. And that is a valid potential option. However, what I would love to be able for that patient to do, or for you to be able to do, is to actually see, is it the tailbone itself, or is it some of these other muscles that are actually creating that pain? And a physical therapist that's specially trained in internal muscle work can really be the one to both evaluate the position of your tailbone and your spine and assess all of the muscles and ligaments around that tailbone that can also be generating the pain. So really, your pelvic floor physical therapist is sort of your best bet to make sure to kill all of those birds with one stone. To be able to look at your hips, to be able to look at your spine, to be able to look at the tailbone itself, and to be able to look both externally and internally in a very in-depth exam that will pinpoint the actual pain generating tissue. So that is some of how the pelvic floor can manifest. Now, what is not in your imagination, most of the people with pelvic or with tailbone pain will also sort of complain of all sorts of other pelvic floor dysfunction. This is another area that you need to assess to see if you have tailbone pain plus one of these other things that I'm going to talk about, then you for sure need to get to a pelvic floor physical therapist. So if you have any accompanying urinary issues, right? Painful urination, urinary hesitancy, urinary urgency and frequency, some incontinence. If you go more than 8 times a day in urination, if you go more than 2 times per night, urination, right? If you have painful bowel movements, if you have incomplete emptying of your bowel movements, meaning you think you go and then you just feel like you can't quite eliminate fully. And if you have any accompanying hip pain, back pain, SI joint pain, which is pain sort of in this really, really low back area, kind of right above where the tailbone is, if you have pain along this area, so the glutes and your hip bone is up here. So if you have really deep gluteal pain, that all of those things can mean that your pelvic floor is also impacted with your tailbone, either injury or pain. And remember, you don't have to have remembered a big tailbone injury to have really significant tailbone pain. And so one of the hallmark signs of tailbone pain is pain with sitting, because we literally sit on our pelvic floors. And especially if we have poor posture or slump, we're actually sitting right on our tailbone. So a lot of my patients with tailbone pain will actually sit forward and try to get off of their tailbone, or sit to one side or the other. And that inadvertently can cause a lot of other imbalances in both your pelvis and some of the muscle structures around your pelvic area. So I'd really encourage you to take a look and see if you have any of those other accompanying symptoms of pelvic floor dysfunction. We have a screening protocol that I've developed called the Cozean Pelvic Floor Dysfunction Screening Protocol. One of the things on there is that you have a history of falls on your tailbone, even back into childhood. I always tell my patients, if you can remember a time, it was significant, right? We all fell as kids and we all don't have tailbone pain. But if you can remember a specific time where you fell on your tailbone in some form or fashion, or your really low back, and you remember it, and I don't care what age you were, anywhere from super little, like kindergarten age, all the way up to like a teenager, if you can remember it, it was significant, and you would answer yes to one of those questions. So the Cozean Pelvic Floor Dysfunction Screening Protocol is a series of 10 questions, and if you answer yes to 3 or more of those, and if you have tailbone pain, it's really an extra 2, then that means that your pelvic floor because of all of that specific attachment of the pelvic floor muscles to the tailbone has also been impacted by whatever pain is going on at your tailbone. Then it's without a doubt that you need to get yourself to a pelvic floor physical therapist. If you're female, that's great. If you're male, I would highly recommend that you look for somebody that is also well-versed in treating male pelvic pain as well, so that they can make sure that they know how to treat you and can do a short internal rectal exam as well to make sure that they can look at the muscles. So I'm hoping that's helpful. So don't fear if you have tailbone pain. It can be really debilitating, but it can be very much helped. And we have both external and internal techniques that we can use to help all of those muscles around the tailbone and how it relates to the spinal motion. We can help with all of that as a pelvic floor physical therapist. So pelvic floor physical therapy really kind of is your one-stop shop, and we can help to see if we really do need to get a chiropractor on the team or some pain management or something else to help us out. But we really are the ones that can assess both internally and externally everything around your tailbone and see how much the other things play a factor in that tailbone pain for you. So if you need help getting to a pelvic floor physical therapist, make sure you reach out to us either on email, DM us on Instagram. We're at PelvicSanity. You can email front desk at pelvicsanity.com, and we'd love to hear from you and help you to find a PT in your area.